Welcome to Dr. Health Hub channel. Today we're going to talk about a women's health topic that many experience but often feel shy to discuss. Have you ever noticed changes in vaginal discharge and wondered what it means?
Yes, vaginal discharge is completely normal for most women, but sometimes it can be a sign that something is not right. Let's explore together in a simple and clear way.
So, what exactly is vaginal discharge?
Vaginal discharge is a natural fluid that comes out from the vagina. It's the body's own way of cleaning and protecting itself. Every woman experiences it, but the amount and appearance can change depending on hormones. During some days of the cycle, it might be thin and watery, and on other days, especially around ovulation, it may look thicker or stretchier. This is completely normal. But if the discharge suddenly changes in color, amount, or smell, it may be a sign of infection or another health concern.
That's interesting because many women don't know what's considered normal and what's not. What are the main reasons this discharge happens?
The normal kind is simply caused by hormonal changes, especially estrogen, and the body's self-cleaning process. But when we talk about abnormal discharge, there are several common causes. One is yeast infection. This often produces discharge that is thick, white, and lumpy, almost like cottage cheese, and it usually comes with itching or irritation. Another is bacterial vaginosis, which is often thin, gray, and has a strong fishy smell. Then there are sexually transmitted infections, such as trichomoniasis, where the discharge may look yellow or green, sometimes frothy, and often with an unpleasant odor. Other causes include cervical or vaginal inflammation, and sometimes lifestyle factors like poor hygiene, wearing very tight clothing, or using scented sprays or soaps in the genital area. All of these can upset the natural balance and cause changes.
So, the body does produce discharge naturally, but we have to notice the changes. How can women tell the difference between normal and abnormal discharge?
That's the key point. Normal discharge is usually clear or whitish, has no strong odor, and it changes slightly depending on where a woman is in her cycle. It's healthy, and it helps keep the vagina clean and protected. But when it becomes abnormal, there are warning signs to watch for. These include discharge that turns yellow, green, or gray, or discharge that is suddenly blood-stained outside of menstruation. A strong, unpleasant smell is another warning. If it comes with itching, burning, redness, or irritation in the genital area, that's not normal. Pain during urination or sex is also a sign that something more serious could be happening. These symptoms mean it's important to see a healthcare professional.
That makes sense, but if a woman does notice abnormal discharge, what can she do about it?
The most important thing is not to panic. Many causes are treatable and improve quickly once they are identified. Some mild cases can improve with simple hygiene measures, like keeping the area clean and dry and avoiding irritants. But if symptoms continue, get worse, or are accompanied by pain, a medical evaluation is necessary. Doctors may give treatments depending on the cause, whether it's yeast, bacteria, or something else. It's very important not to self-diagnose or use over-the-counter medicines without knowing the exact cause, because using the wrong treatment can make the problem worse.
So, it's really about knowing when to seek medical advice and not just guessing. But what about prevention? Is there a way women can reduce their risk of abnormal discharge in the first place?
Yes, prevention is always better than cure. There are several helpful habits. First, maintain good hygiene, but avoid harsh soaps or strong cleaning agents. Just washing gently with water is often enough. Second, choose breathable cotton underwear and avoid very tight pants, which can trap moisture and encourage infection. Third, during menstruation, change sanitary pads or tampons regularly. Fourth, avoid scented sprays or vaginal douching, as these can disturb the natural balance of bacteria. Fifth, practice safe sex, because sexually transmitted infections are one of the major causes of abnormal discharge. And finally, routine gynecological checkups are very important, especially if you experience repeated or unusual symptoms. These checkups can catch problems early before they become serious.
That's really practical advice. So the message is that discharge itself is normal, but changes can signal something we need to pay attention to.
Exactly. Every woman should understand what is normal for her own body. That way, she can quickly recognize when something is different. Early attention and medical care can prevent bigger problems and keep women healthy and confident.
So, vaginal discharge is part of women's health, and it shouldn't be ignored or treated as something shameful. Knowing the signs can help women protect themselves better.
That's right. It's about awareness, prevention, and seeking help when needed. Women's health is an important part of overall health, and small changes can sometimes give us big signals.
Thanks for sharing this. It's very helpful. And thank you for watching Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health tips.